Uh, you can see the screen, I believe, anyhow. So basically, yesterday we have discussed about the clinical criteria. So today we are discussing about the linguistic. So first of all, like in term of linguistic, the first and foremost thing is the fluency. So you have to speak at length without any pause, and with natural pauses actually. That is, we can say as a fluency, a person who can speak at length with nothing. So let's be define in detail further. It is your natural flow of speech, what we can say, the way you speak your mother language, natural flow of speech, right? And try not to have the ahs and ums, you hesitation, okay? We must use we must avoid the hesitation such as ahs and ums. The second thing that is important for you is the we can say intelligibility, right? This is the second criteria. This is your basically natural intonation. What is intonation? You mean that you have to manage your stress when you are speaking a sentence. So highs and lows in your sentence while you're speaking, where to put stress and where to dip. This is the natural intonation at the level of sentence, and maybe the correct word stress, right? When you are pronouncing certain words, let's say vegetable, we can pronounce it in this way, and you can see that it's your pronunciation. I would say that you should know. Okay, it should be clear, understandable pronunciation, and people are concerned about the accent. So that should be kept in mind that you must have the any accent that is understandable. Accent should be understandable, right? Okay, accent should be understandable to everyone. Is it clear to you? Okay. Afterward, you can say we have the appropriateness. What we have in the appropriateness, you must have the right tone and the right language. You must have the right tone and right language. And uh, according to the patient, you must design your consultation. Okay. So basically, your formality should be appropriate. And the last part in the language is the grammar. So for the language part, so you must have the range of grammar, when to use past tense, when to use present tense, and it must be accurate. And you have to use the cohesive devices at the same time, right? In there, use the cohesive devices. So this is a brief overview of the linguistic criteria. Now today, as we discussed yesterday, that we'll be discussing about the second encounter and different types of cards. So we'll be discussing about the breaking bad news. Right? So you can see there that this is a follow-up visit. The patient who is having 1 month history of you can say rectal bleeding, diarrhea, and weight loss. He requested a camera test like colonoscopy, and he's here to collect the reports. And we had unfortunate news that is tumor in the descending colon. So this is the result that has been shown to the patient, and chemoradiotherapy, colostomy, and everything. Anyhow, this is the card that you will see, and you'll practice that in a moment about the steps that you have to take for the breaking bad news. So in any of the card, when the patient is coming to you for second time, you can start the card with the tagging, right? Statements with the tagging questions. Okay. So if you can see there, like after introduction, like you can greet yourself. Hello, my name is, let's say, Dr. Blah and blah. So when you are starting the card, when you are initiating the conversation with your name and whatever, so at that time you should have a low tone so that it will give an impression to the patient that there is something serious might be in the news. So right, as compared to the normal start we have with the high tone. So we can start with the tagging question. Like after your name, hello, my name is Dr. Blah and blah. If I'm not wrong today, Mr. Mark, you are here to collect your camera test report, right? So we can start with the tagging question. If we can start the card like if I am not wrong, let's say today you are here to collect the reports of your camera test, right? But from the very beginning, this is the first statement we use. We have a low tone, right? Then you can discuss about the background. What is the background? Let's say. So let's say I can see from a file that you have 1 month history of everything that has been done, but do not use the medical term. You have 1 month history of like bleeding from your back. You can use that rather than rectal bleeding, right? And loose motion, maybe for the diarrhea. Okay, and the weight loss as well. Then you can ask the patient like, have you noticed? Like, say this is your tag question. This is the background question. Then you can ask the patient if you have noticed any improvement or if there is a worsening of symptom, like an improvement in this card only, or if you have noticed any worsening, you can ask this question. Then you can ask the patient belief or expectation, like what he think that why his symptoms are not settling, right? And patient past experience of medical reports, number one. And if you would like to call someone, maybe family member, if you like to call someone, like, or can we discuss here or move to private, or then we can break. Unfortunately, we have some serious news. And this is the point you break the news. So, from the very beginning, when you started the card with tagging question till this point, you must drop your tone like that. So, tone should be dropped. Okay. If this is the case when the patient will be in spot of you. I mean to say that if he is not an aggressive patient or if he has not given you tough time when you are breaking the bad news, right? But if the patient would give you tough time anywhere in the card, maybe over here, let's say, he became aggressive. So we can modify our counseling. You can ask the patient, I have in this card only, I have good news and bad as well. So which we like to listen first. If we go for the good news, then you can tell that fortunately, we have caught your disease in a very, very early stage that is treatable and manageable. And then the bad news is that we have, let's say, the camera has confirmed that there is excessive growth in the lower part of large intestine, like that. Anyhow, so this is the steps that you have to take from tagging, from background, from, let's say, patient expectation, from like any sport, from family, right? My previous experience, or you can say counseling room, or lastly, we have the teaser, then the news. So we can follow this graph when we break the bad news, right? In case if the patient is following your consultation, he's not going to give you, like tough time anywhere. If he would give you tough time anywhere in the card, maybe over here or over here, so you can move on to the point like accordingly. Either we have good news or either we have bad news. After breaking the bad news, take a pause, like maybe 10 second or 30 second. Offer him glass of water. Tell him that you can take your time or see the response of the patient. If the patient is in shock, right? If the patient is maybe if the patient become in like denial or he become aggressive, so accordingly you will handle. Let's say if the patient is in shock, give him some time. Okay, tell him that you can take your time, and then after giving him glass of water, you can tell the patient that we have good news. If the patient become aggressive again, you have to allay the patient feeling that Mr. Mark is understandable, but don't worry, we and my team is here, and we are going to refer you on the immediate basis to the surgeon so that it can remove this thing early on. Accordingly, we have to adjust. In this case, after referring this patient to the surgeon, we can move on toward the next point. The next point is about a chemo. So now we patient. So in this case, now we can see there that the patient has this for the chemo radio, right? For the chemo radio, the patient is having you can say some concern. So accordingly, like you have to ask the patient like politely why is so concerned about this chemo radio. First of all, before you can ask the patient to go for the chemoradiotherapy or consult the patient for the chemoradiotherapy, you need to explore patient concern. Before you have to assure, sorry, before you can assure the patient concern, you have to assure the patient that it would be your choice purely whether you can go for the chemoradiotherapy. But being a healthcare practitioner, I would like to guide you the pros and cons of this chemoradiotherapy. Okay, is it clear to you? Afterward, we can move on to the colostomy bag, and again, you should use the layman words over here and assure the patient there is no need. And the last point, you can also assure that there is a high chances of your recovery and prognosis is quite good, right? We'll be discussing setting a suburban clinic. The patient is here. He is here for the medical certificate and he's just trying to make a ground for his medical certificate in view of her recent divorce. You can see the first task is that you have not to issue the medical certificate, but we will not directly refuse the patient that we are not going to give you the medical certificate, we have to prepare the things up for that. So starting from the normal greeting, hello, my name is, let's say, Dr. Blah and blah. I'm one of the doctor in this abdomen medical practice. So I can see from your file that, or maybe you can not start in that way. We start, hello, Mr. Mark, how can I help you today? He will tell you that, doctor, I'm just a broken person. I recently had a divorce and I'm quite depressed. I just want to go for the place for the vacation to the place that is close to the nature. And considering my depression or stress, I want to have the medical certificate. So first of all, provide empathy. After listening to this card, listening to the after open question, you will start listening to the main complaint. Provide empathy in this case. Empathize the patient. No, it's totally understandable. It's totally understandable that it's one of the traumatic event you have had. So, but in order to better understand your condition, I'd like to ask some question. If you allow me, we can ask certain question, maybe about the diet, maybe about the sleeping pattern. Okay, and then you can ask, okay, Mark, I would like to ask some more question. Uh, can I ask you what is your understanding about the medical certificate? And when you answer the knowledge of medical certificate, do not deny what the patient will tell you, but you have to appreciate. I appreciate your knowledge. However, let me educate you. So whenever you're educating about the medical certificate, in your answer there should be no, not directly, but you educate the patient. The medical certificate is a kind of certificate that can be given by the doctor if the person is having some abnormality or anomaly in the medical reports. As in your case, we do not have any of the medical reports, let's say, not now, but you can tell the patient basically a medical certificate can be given if the patient is having some anomaly in the medical certificate. And secondly, maybe a psychologist can write a medical certificate for depression, but for GP, we need a medical certificate. So, in this regard, as you can see that we don't have any positive finding in terms of like there is no medical issue. Fortunately, like there is no medical issue. So that's why I believe that you might not be able to qualify for having the medical certificate considering your like normal medical reports. The patient might be aggressive and become angry over here. So you can tell the patient, "Miss, I totally respect your feeling. However, it's totally relatable and understandable that you are facing a difficult time. But if you can see already, I can see from your file that you had discussed with your boss regarding the casual leave, and he has refused. Now, upfronting the medical certificate in this regard, it would be having a negative consequence. It will mislead the situation, and I believe it's a professional misconduct, right? Considering that there is no medical ground, we cannot write a medical certificate over here. Then he can use the again, he can tell you that if, he can give you tough time. You have to assure the patient that is quite serious matter, and I can give you the medical certificate like a sick leave certificate, and then you can go to the place close to the nature. Just try to be sick, and it can be a point of concern, and it can be questioned by the boss, right? And we both can face serious consequences in that regard. And as a being a GP, as per my job description, I might not be able to allow. I might not be able to write it down for you. Then you can talk about the you can say sex affair. I totally respect what you're saying. It would have quite difficult for you. It would have been quite difficult for you to manage everything. I understand that, and like totally allay your feeling in that regard. But what we can do is we can refer you to the psychologist. He can guide you, and this those guidelines will be really helpful for you, not in short term but in long run as well, right? So in this way, you can go for this card. Any question that you want to ask? You can see that in today's class, we are discussing most of the cards are the counseling based. Similarly, this is also a counseling based card. Here, it's a kind of unique and different card. It's about the medical power of attorney. It might not be quite common in our practice in here in Pakistan, India, or Bangladesh, like these subcontinent, but it might be. Please. So basically, we have to see about the medical power of attorney. As we had discussed about the clinical communication skills, we have to apply all the skills over here for uh, in this card. Anyhow, so you can start the card with normal greeting after introducing yourself, like who you are, and then you can also discuss the name of the patient in the preparation time. So you can directly call the patient name. You can ask the name of the patient for the confirmation purposes. Can I confirm your name and age? It's totally fine, right? So whoever the interlocutor will be, you can see that I have seen your file. After that open question, after settling him down, you can offer him glass of water or maybe cup of coffee. So you can ask the patient, I have just gone through your file and I came to know that you're having some medical problem, such as your motor neuron disease. Uh, but and it's on the advanced stage. But if you can tell me your own words, what is your concern? Or else you can simply start, how can I help you? It would be more better actually so that we can avoid the jargons. Sorry, I'll try to make it more. Basically, we can see there, this is a counseling based card. So the patient is here and he want to ask your basically guideline and advice regarding the appointment of medical power of attorney. So he's having a condition called motor neuron disease, and for that reason, it's in the advanced stage. He want to ask you, would he be able to apply for, or should he have to appoint someone as a medical power of attorney? So, as a matter of fact, you can start this card with normal greeting, like with your name. My name is, let's say, blah and blah. I'm one of the doctor in this medical practice. So please come and have a seat. Then offer him glass of water or maybe, let's say, a cup of coffee and so on. Then you can ask the patient with open-ended question. Let's say, how can I help you? Simple, right? Simply, you can start the card with, how can I help you? Okay. So after that, the patient will tell you, I'm here because I'm having a medical condition called motor neuron disease, and it's a kind. For in that view, I need to ask you, should I appoint someone as my medical power of attorney? Should I appoint someone as my medical power of attorney? Actually, he will ask you this question first of all over here. So, what would you do? What would you do actually? You would just ask the patient, what is your understanding about the medical power of attorney? What do you know? Right? It's very important for you in any card. As you can see over here as well, you have to ask the patient, okay, about the knowledge. Okay, Mark, before we can discuss this thing, can I ask you what is your understanding about the medical power of attorney? Okay, and then before explaining this thing, you can ask the patient, do you have anyone in your mind to whom you want to appoint or to whom you don't want to appoint? Okay, I would like to ask after this explanation, right? Like he would ask you that is it necessary to me for me to appoint someone as my attorney, and should I appoint someone else other than your son? Then you can ask here a personal question. Yes, first of all, let me show you. And first of all, it's not even necessary to appoint a medical power of attorney. It's purely your call, right? It's purely your call. You can, if you don't want to appoint someone, uh, it's your call, right? Number one. Number second, you can appoint anyone as your attorney. And do you mind if I can ask a personal question, if you allow me? Is there anything that is ongoing between you and your son that you don't want him to be your attorney? He will tell you that he's not close to you. And beside that, is there any other concern of yours? Because we are leading toward the next question. We know that he want to ask you this question. He will ask you that if I would not be in a good mental state of health and my son can appoint him as my attorney, so what would be the consequences? Then you will explain the patient that you need to be in a good mental state of health to point someone, otherwise it will not be acceptable. Okay. Then he will ask you about the like the role of MPUA in view of the last day care and the we can say mercy killing. So you have to ensure that this is not the titlement of the MPUA, that he can refuse the last day care or maybe the end of life choices. Okay. Yes. So afterward, he will ask you like what need to be done. You have to assure the patient that you will make a plan, like write a will, and according to your will, we will make you can say your end of life choices. So rest assured that me and my team will support you in this time point of time, right? So I think this is clear to you regarding MPA. Basically, it's a simple explanation, might not be written in the card, but you can explain the patient, a person who can take a medical decision on your behalf. It's written actually. The third line, should person loses the capacity to make the decision. So MPOA is a person who can take a medical decision on your behalf. And let's say if you won't be able to understand, so in the prep time you can ask the interlocutor like, what is the role of MPOA? However, you can just discuss this thing. A person, if you can nominate him as your MPOA, he can take a medical decision. So I hope now somehow it's clear to you. Operating theater suite, and we have a patient who is booked for the surgery, and his review appointment has already been booked in the laboratory. So we can start this card in this way. If you can start this card in wrong way, you can be having penalty for that. So we can start this card in this approach. Hello, my name is, let's say, Dr. Blah and Blah. I'm one of the surgical resident in this operation theater suite, and I have been informed that you are having some concern regarding your lump. Your so if you can tell me your own words, what is your concern? The patient will tell you about something, like I believe that it's cancer and so on. You have to ask the patient, first of all, assure the patient that it's totally understandable that considering the size of the lump, that you would be concerned. But I would like to ask some question. Do ask like the painful, or let me have a look over there. And I can see that basically as you already booked for the surgery, so less likely, as per the clinical picture, it would be I can say this thing either it's not normal, right? Then you can answer the patient concern about the laboratory finding, that they will understand your lump well after reviewing this thing in detail, right? So then you can move on toward that. And afterward, you have to discuss about the scar, like it will fade with time. And last point is the removal of lump. You have to show that unlikely that it will be removed. Okay, unlikely that it will not be removed. Sorry. So this simple card, if you can see that you are on the workplace. This is workplace health assessment. Normally, we do a card when the patient is here at your clinic, but now you are at the workplace, and now you are conducting this 15-minute health assessment. The rest of the things will go the same as we are having normally, but the start of the card will be different. You can see that there is a 50-old year worker who is not willing to go for the assessment. There are multiple reasons for that, and these are the reasons. First of all, about the privacy, and it's been a long time. Then he has not have any medical checkup, and he's concerned that he may develop the diabetes. So we can start this card in this approach. Hello, my name is, let's say, Dr. Blah and Blah. I'm one of the doctor at your sorry. You can start this card in this approach. Hello, my name is Dr. Blah and Blah. So I'm one of the doctor who is conducting this health assessment as per the request of your employer. So we are not going to have more than 15 minute session while conducting the health assessment. So before we can start this health assessment, if you like to ask any question, or else if you have any concern regarding this health assessment, please feel free to ask me. So you have to ask these questions from the patient regarding to the card, right? So then you have to show the patient that first of all, considering your concern, that these are typically confidential, number one, and second thing is that you will get your feedback on immediate basis, and followed by the advice, followed by the importance of the health check. You can use the cohesive devices. Like to begin with, well, the most important thing in having this assessment is, as an employer, they need the healthy workforce, and there are multifarious range of benefits that one can be having. First of all, it will improve the productivity, and secondly, it will also minimize the injuries at workplace, etc., and so on. Now, moving on toward the personal benefit, we can also have a lot of understanding about your health. But I can see that you are concerned. So, can you tell me in your own words, like, is there anything else apart from the privacy that you want to ask? Maybe you can discuss over here, or maybe over here as well. Then he will tell you that her brother had diabetes. So then you have to counsel the patient that he has to go for the, like to the local doctor for that, and followed by the diet and exercise modification, right? So this is the card that we have to do in this approach. If any one of you would like to do this card, so you start the card in this approach. I'm one of the doctor on the behalf of your employer. We are conducting this health assessment. It won't take much time. We'll just need 15 minutes of yours. But if you can tell me before we can start, if you have any concern or if you want to discuss anything, please feel free to ask me, right?